You may have noticed your newborn grasp your finger tightly or turn their head toward a gentle touch on the cheek. These brief moments are not random. They are early reflex circuits that help the baby navigate life outside the womb. In this video, we will explore the core reflexes seen in the newborn period, understand the mechanisms that produce each behavior, examine real-life examples, and highlight what caregivers should take away from these early developmental patterns. The rooting reflex occurs when a newborn's cheek is gently stroked, prompting the baby to turn toward the stimulus. This reflex is driven by early cranial nerve pathways that support feeding. For example, a baby may nuzzle toward a caregiver's hand during positioning. Caregivers should recognize this as a normal search behavior, not a sign of hunger intensity. The sucking reflex activates when something touches the roof of a newborn's mouth, triggering coordinated tongue and jaw movements. This mechanism relies on well-organized motor patterns present from birth. A typical example is the immediate rhythmic sucking when a nipple or clean finger enters the baby's mouth. Caregivers can see this as a sign of healthy neural coordination. The Moro reflex appears when a newborn senses a sudden loss of support or a loud change in the environment. The arms extend outward and then return inward in a coordinated motion. This reflex is believed to help infants respond to unexpected shifts. For example, a slight lowering during a transfer may trigger it. Caregivers should interpret it as a protective reaction, not distress. When an object touches a newborn's palm, the hand closes firmly in response. This grasp is produced by spinal-level motor circuits that operate before voluntary control develops. A common example is a baby holding a caregiver's finger with surprising strength. Caregivers can view this as evidence of intact early motor wiring, not intentional holding. The plantar grasp reflex is elicited when the base of the newborn's toes is touched, causing the toes to curl downward. This response supports early balance mechanisms. For instance, during diaper changes, a light stroke on the foot may cause the toes to flex. Caregivers should understand this as a normal developmental reflex, not discomfort. When a newborn is held upright with the feet touching a flat surface, alternating stepping movements emerge. This reflex comes from primitive locomotor networks in the spinal cord. A typical example is a baby walking when supported under the arms. Caregivers should see this as a precursor to later coordinated walking, not an attempt to move independently. The tonic neck reflex appears when a newborn's head turns to one side, causing the arm and leg on that side to extend while the opposite limbs flex. This posture is shaped by early neural symmetry patterns. For example, during tummy time, a baby may naturally assume this fencing posture. Caregivers should interpret it as an automatic coordination pattern, not a preference for one side. The Babinski reflex occurs when the side of a newborn's foot is stroked, causing the toes to fan outward. This reaction reflects immature corticospinal pathways, which gradually integrate as voluntary control matures. For example, a gentle swipe along the sole may elicit this response. Caregivers should recognize it as typical for infancy, not a sign of abnormality. Newborn reflexes gradually integrate as the brain and motor pathways mature. Most reflexes fade between 4 and 6 months, though some, like the Babinski, may persist a bit longer. Caregivers should see this timeline as a sign of healthy development, reflecting increasing voluntary control. Newborn reflexes are foundational patterns that reveal how the nervous system operates before voluntary control emerges. They are automatic responses, not intentional acts, and they help babies adapt during their earliest weeks. By observing them calmly and consistently, caregivers gain insight into healthy development. Subscribe to learn more about your baby's growth with us.